explain to me what we're doing here today, just briefly.
Well, this is an event for community faith-based leaders in the Northwest Indiana area, and to help bring them information, or give them information, I should say, about the types of healthcare programs, healthcare initiatives that are in the area, so that we could take this information back to our congregations and parishioners.
How do you feel that faith-based communities or faith-based organizations can make an impact on their community?
One of the things that's important to understand, especially in faith-based communities, that oftentimes they are the most trusted people in the community. And even though they may be presented with information that they should act on or respond to, they won't, because it's not coming from that faith-based arena. And so when you have faith-based arenas interact and get information, it's more trusted and more believable, and therefore it's more valuable.
How do you feel today's event could make, it's obviously a resource for you, whether it's a speaker or it's the actual resource fair. How do you think you and your fellow, colleagues at faith-based leaders can really make an impact on the community with an event like this?
Well, I think one of the things is developing some type of action plan, because the spirit, soul, mind, and body are not separate entities. They are all lodged within one person. And so therefore, to be, I think, an effective faith-based or spiritual leader, religious leader, you can't separate those. They're not discrete objects. They are congruent. They work together. And so being able to get this knowledge and this information is to be able to have it, one, for yourself personally, but also to serve as a resource to your congregation, and to continue to push them to strive towards not only better spiritual health, but also better mental health, also better physical health, which in turn, because everybody influences somebody, and so that also will help to heighten their influence with some level of education that will create, as they said earlier today, a culture of health, a culture of change.
Last question. What's one thing that you hope to be able to take from today?
Well, one of the things I was impressed with, and I didn't realize it was such an issue, is the tobacco. I don't have anybody in my immediate family that smokes. I don't smoke. My children don't smoke. My husband doesn't smoke. And I only see that sometimes in my professional life, as an employee of another institution. So I didn't realize that sometimes is a challenge for faith-based organizations and churches and so forth. And so developing a cessation program, or encouraging people to use the cessation program that's at their place of employment, because I know we have one where I work. But also for the church to develop one and a statement, and then to provide resources to help people to be able to end that type of addiction. There are many addictions, but to help, because that one is such a prevalent one.
Exactly. How important do you feel faith-based programs, leaderships, even congregations, to really go out and find aid for people within their community?
Well, I think most congregations are generally not equipped to address a lot of the issues that our congregation members are dealing with. And so our particular focus is on issues related to mental and behavioral health. Most pastors, and I've been a pastor for over 30 years, most pastors do not receive much training in terms of counseling, mental and behavioral health issues, and yet, if the statistics nationally are 1 in 4 or 1 in 5, depending upon what source you're looking at, in the population is living with a mental or behavioral health challenge, to me that means 1 in 4 or 1 in 5 in our congregations. So that's a significant number. So within our congregation, we probably don't have those resources, so there's benefit to go outside and start looking at some of that. And if we can connect with an organization that is focused on providing assistance for faith-based organizations like a church, I think that's the place you really start.
Why do you feel that faith-based organizations are almost like a direct line to the folks in the community?
Well, every congregation is a little bit of a microcosm of the larger community. And so people in a church are just normal people. And so whatever the larger issues are out in any community, there's a microcosm of that within our congregation. So we have people dealing with all kinds of health issues, physical health issues, but you also have people dealing with depression, anxiety, bipolar. There's people in our neighbors, the people that we work with, are dealing with all of that sort of stuff too. And I think that all of that, anything for a Christian, is a faith issue. That doesn't mean that the answer to the issue is pray harder, have more faith. I'm not suggesting that. But anything that happens to us in life as a Christian intersects with our faith. So we need to talk about that in appropriate ways.
What kind of impact do you think events like it as well will make on you and the people that follow you?
I think it's a springboard. It's getting people talking about it. We generally don't talk about these kind of issues in the church. That's why, and you've already heard it a couple times today, stigma is huge. Well, the more we talk about that in the church, the more we're beginning to break that stigma down. We're beginning to normalize some of the language. That opens people up to feeling like, okay, within this environment and within the body of Christ, we can discuss this. I try to encourage pastors, don't just pray for people who have cancer or heart disease or recovering from a surgery. Let's also pray for people who have depression, who are dealing with anxiety, who may have a family member with bipolar. The more we talk about use the language, then the more it gets normalized a little bit within that context.
What do you hope for yourself or for everyone else that's attending here today? Just one thing to take from today at all. If they could find one thing to leave with, to be able to help others with, what do you think it should be?
There are resources. Even within the faith-based community, there are resources we can turn to. And we don't need to be ashamed of talking about things like this in the body of Christ, because we know people are dealing with it. Let's just talk about what people are dealing with.
Explain to me why you're here, or what event are you at?
Well, we're at the Interfaith Health and Wellness event here at 2820 South Meridian, and we're here to gain resources and gain opportunities for partnerships with the local community, the local faith community, as well as community-based organizations that are reaching out to people who are of need in any way, shape, or form. We're just looking to find partnerships and collaborative partners to grow our ministry and reaching out to the community.
How valuable do you see a summit or a conference like this for every community?
Well, I'm glad to be a part of the inaugural Interfaith Health and Wellness Summit for the fact that we get the opportunity to see the enthusiasm, we get the opportunity to participate in some of the interactive programs going on. Great speakers, also a great networking system for the faith-based community and the community-based organizations, whether it be private or public practice. We just appreciate all of the vendors that have come out. Lots of resources that I had very little knowledge about. I was able to gain quite a bit of knowledge as pertains to the resources. But the main thing is that now the community is wrapping their arms around each other and joining hands in regards to making this a better opportunity for people in need in the community.
What do you think the number one thing that you or everyone attending should take home with them?
Connection. Connection is the word.
Start that off.
Okay. Well, I believe that every person should take home with them, specifically myself, is the word connection and building relationships so we can be able to grow as a faith community and as a community-based community as it pertains to helping people in need. It's about connecting with people, building those relationships, and once those relationships are built, we're able to move forward in the process and with progress of helping people with their physical, mental health.